My name is Tim Maria, host of Digital Health Live here at the Digital Health Summer Summit, San Francisco. I'm super excited to announce my next guest, Dr. Adam Gazzaley, who's an entrepreneur as well as a professor of neurology at UCSF. How are you doing?
Good. Thank you for having me.
So interesting last panel, but let's hear about your background first.
Yeah, so I'm a MD PhD. I'm trained as a neuroscientist and a neurologist, and most of my research has been understanding the aging brain and plasticity of the brain. And now we're interested in taking the concepts and the methodology that we used in the lab and develop new technology to enhance the brain.
Yeah, I remember, I think it was a CES event where it's good for people that are aging to try learning new languages and things like that. So the panel is basically Frontline Innovators, UCSF, Dignity Health, Kaiser Permanente, plus Luncheon and Expo. There's a mouthful. What was going on inside?
So basically, as a panel, we were all giving a snapshot of technology that we developed that are sort of innovative and disruptive in the healthcare space using digital technology.
So you're building some new types of games in the lab and then commercializing those. What was the concept originally, and where are you at?
Yeah, so the basic idea is that there's a lot of innovation in the digital space, especially video games, and on the hardware side, Oculus Rift, Connect for motion capture. We're interested in taking the immersive abilities and the adaptivity of that and building new interactive platforms, and then challenging the brains of individuals from kids to older adults to healthies to clinical populations, and then use brain recordings and careful control groups and see if we can improve how their brains function and improve their cognitive abilities.
So you're putting EKG, EEG, galvanic skin response, all types of sensors?
All of it. We already have used those tools like functional MRI and EEG in the lab just to understand how the brain works. Now we're using it as a way to study the effects of these new innovations and interventions on improving how the brain works. So it's a way of looking at outcomes in terms of brain function to understand the mechanisms of what we're trying to induce, and then to see how that relates to changes in their behavior and their cognition.
So what is our brain and what happens over time? Does it get solidified, crystalline, or what happens?
Yeah, well, we now appreciate that our brains are plastic, meaning that they adapt chemically, structurally, and functionally in response to new experiences, which is the very basis of learning. For a long time, we thought that ended after critical stages of development. Now we know that your brain retains plasticity throughout your entire life. And what we're trying to do is essentially harness that plasticity as sort of a fuel for an engine of changing the brain. And then we just take advantage of video games to activate networks in the brain, and then use the mechanics of adaptivity such that the games scale the challenge as your performance gets better, as well as feedback loops to make them enjoyable and engaging and deeply immersive. And so through an integration of this adaptivity and the feedback, we feel that we have the ability to push on those neural systems and then change them. And then in the lab, through careful experimentation, we could show how successful we are with it and then iterate and develop better interventions.
You're taking a tough path to doing this, actually getting FDA approval. Like your target market is to be basically FDA approved.
Yeah, I mean, I think that the world of medicine is ready for major disruption in terms of having a very siloed approach to treatment right now, which is basically pharmaceuticals. And in order to change what a doctor is willing to write on a prescription pad, we have to, in many ways, just go right to the belly of the beast and try to play by the same rules, at least at the beginning. And so the concept is, can these video game technology that we're developing be validated in careful controlled studies, understand the efficacy, the side effect profile, just like a drug, in different clinical populations. That's the idea. And then hopefully in the future, if that turns out to be the case, that we have careful validation, that there'll be other things in the toolbox for a doctor to reach for when interviewing a patient with any neurological psychiatric condition. That's the dream, that we'll be able to have more than just a pharma approach.
Very cool. So how do people link up with you, connect up?
Yeah, so we have a lab website, my last name Gazzaley. If you search that, you'll easily come across my website at UCSF, and Adam Gaz, ADAMGAZZ for Twitter and Facebook. And
so that's Gazzaley. And well, so fascinating. I'm going to have to come up to UCSF and
come
check
visit.
out what you guys have cooking.
Yeah, we built a pretty high-tech lab called Neuroscape Lab because we eventually realized that this type of research itself, we didn't have a lab to do it. We didn't have a place to do virtual reality experiments like with the Oculus Rift and full body motion capture. And so we built a new lab to integrate tech, software and hardware, with neuroscience to really try to push the needle in this domain.
Do you have the Sixth Sense system in there?
We pretty much have them all.
Okay, I'm coming down there, you guys. We'll do a special episode. I'll come in. Yeah, cheers. All right, Adam, thanks a lot.
Thanks. Nice meeting you.